Good morning, everyone. This is Dr. Tom Warcup from the Block Island Medical Center. Today is Thursday, November 5th. This is pandemic day 248. I want to talk a little bit about our data as well as some coronavirus testing. Rhode Island is starting to see an increased surge as well as our region. Rhode Island had a positivity rate of 3.3%, up from 3.2. Connecticut has gone from 4.1 up to 4.9, and Massachusetts has risen all the way up to 6.81%, up from 6.14%. So we're seeing surges throughout our entire region. Block Island Medical Center has administered over 330 flu shots over the last 4 to 5 weeks. Please be patient. Our state allocation is not always exactly what we'd like. We get a certain amount of allocations every week. We can only order once per week. So we are still maintaining our flu clinics and are committed to vaccinating everyone that wishes to be vaccinated from influenza, but we may need to limit the amount of clinic time as our stocks become smaller, but we will have them replenished and then re-advertised. Please look at all of our advertising entries either on our website or on the Block Island bulletin board for more information. Some clinical updates about what we know about COVID-19 today. That from a treatment standpoint, those individuals that are hospitalized and on ventilators do get remdesivir and steroids. And there's enough now known about hydroxychloroquine is that it is not a drug that is recommended and is found to be ineffective against coronavirus. And no other pharmaceutical treatments have been proven to be beneficial. So steroids have a role for some individuals, remdesivir in a limited capacity, and otherwise there are no other known pharmaceutical benefits at this time. The World Health Organization states that recovery typically takes 2 to 6 weeks. One study found that 20% of non-hospitalized individuals that are 18 to 34 years of age are having symptoms at least 2 weeks after becoming ill. And the same is true for nearly half the people that are 50 years of age and older. So you have symptomatology well beyond, say, the 10 to 14 days. It is unknown post-infection how much immunity a patient will have and how long that immunity will last. You'll have more on that over the next coming months and years. And cold weather does not affect and does not kill the coronavirus. What we do know is that COVID was circulating in New York City earlier than we thought. A Mount Sinai Hospital research team reported in the journal Nature that seropositive samples of COVID have been now uncovered as early as mid-February, and that 20% of the city's population had already been infected. And that's based on 10,000 patient samples from February through July that they had gone back and tested. On a more local note, Rhode Island has the 3rd fastest growth of new cases in all 50 states over the last 2 weeks. Rhode Islanders continue to be the only state on the East Coast, from Florida to Maine, that is in the active or imminent outbreak category on the COVID Act Now application. And that on Monday, the Rhode Island Department of Health announced that it had a 1-day percent positive of 5.1, which is higher than the 3.3 over a 7-day average. So testing can be done by going to portal.ri.gov. This is for asymptomatic patients only. You can schedule 3 to 5 days in advance, and it is meant for the public. Remember that we have COVID testing on Tuesdays at the Fire Barn with Tracy Fredericks. She does welcome walk-up individuals. She tested 63 people on Tuesday, which is up from her 25 to 30 average. So we certainly understand that the community is demanding more testing. We spoke with the Department of Health. They increased today's testing at the Fire Barn through the Crush COVID app, which has its own limitations, from their normal 26 to 30 up to 58, and they are welcoming walk-up patients throughout to about 12:30, 1 o'clock today. So please take advantage of those testing sites both on Tuesdays and Thursdays. Go to the Crush COVID app for the Thursday group and then coordinate with Tracy Fredericks on Tuesday. The state has not agreed to do a testing site again tomorrow, but if we have needs, we can facilitate with the EMS personnel. A little bit more about COVID testing. So Block Island Health Services has an Abbott rapid machine that can help us with rapid identification of symptomatic patients, and it has an effectiveness of approximately 80 to 85%. Those patients with elevated clinical suspicions will also need to get a nasopharyngeal swab to complete their overall evaluation. And the results of that swab will take 3 to 5 days. And then during that time, that patient should be quarantined. If you feel like you've been exposed, then please quarantine for 14 days. Some recommendations are leaning towards 24 days because of the increased surge throughout the state. Imminent testing is not required or even recommended. Testing only gives us a point in time, and remember that the incubation period is on average of 2.3 to 5 days. We are working with the state to increase testing, as I've mentioned, and please be patient. Block Island unfortunately had its 13th case yesterday, and steps were immediately taken to protect the patient as well as our community. The Department of Health is aware and is conducting their contact tracing. Please be patient with the Department of Health. They are trying to deal with the increased surge throughout our entire region. This is important. Contact tracing is dependent on our thoroughness about people and places that we've been. So please be as accurate as possible if you are contacted by a contact tracer. If you feel like you were in contact with a confirmed case, please quarantine. Rapidly seeking testing does not change the need for quarantining, mask wearing, hand sanitation, and social distancing. Social distancing and mask wearing has been coming up on both the Rhode Island scene and our Block Island scene. We are aware of small groups that are getting together without masks. Please be thoughtful about this. We are all accountable to each other. We are at a critical point with the rising COVID numbers in our region. If you own a business, please consider asking all employees to wear masks when they're in their business environment. It is our responsibility to each other. Please consider canceling gatherings of more than 10 people, or at least hold them in an accountable way with mask wearing and social distancing. Please get out and enjoy this beautiful day. It's important to get outside. And as always, the medical center is here to answer any questions you may have. Have a great day.